I
But
guess,
they would still, I mean, you can still pick them up there, and so
Well,
then I think that's a
deer
problem too.
is one of the most,
on their
yeah,
lifespan, it's in 5 years.
Yeah.
socialized with.
What's another species that is occurring nearby in the state of Minnesota that has dropped 30% per year in the last couple? Moose, and they've been doing studies, and they think the ticks are actually the ones that are causing the decline of them because they're so having infestations of ticks.
Well, that's what I was starting to think too, then deer population is going down. Is it the wolves actually, or is it actually Lyme's disease that is, but that's,
Well, that's what, like that Dr. Alan McDonald, his hypothesis is that there may be some sort of relationship between Alzheimer's disease and Lyme.
We got called up to the floor at the old hospital to help with a patient who had fallen out of bed, and this patient was extremely combative. He went and got a hip replacement, so he was 1 day post-hip, and he was on the floor, not making sense, fighting, babbling, and I'm like, check his sugar, is he an alcoholic, is he going through withdrawals, trying to do all these differential diagnosis type things, and we finally were able to get him up, but I mean, not making sense. And this is a man who earlier was alert oriented, no complaints, I mean, 50-some-year-old, perfectly quote unquote healthy gentleman, and they found out that he had Lyme's that went to his brain. And it happened that quickly, where he was alert oriented and rolled out of bed, and he's blood on this fresh hip, and there's blood, and I'm like completely combative, not making sense, argumentative, fighting, and it was that he had Lyme's that went to his brain.
Encephalitis.
And just a horrible. I thought he was withdrawing. I thought he was an alcoholic. That's kind of what it reminded me of, is that he was a closet drinker, and
There's another guy in town here that we picked up.
yes. And he is labeled as, in his medical records, he is labeled as a hypochondriac. And they have been fighting for years now. And he said last year he was putting his everything in order. He's my age. I actually graduated high school with him. And he was making sure his life insurance and paying off his truck, or he was going to sell his truck so that his wife and his kids, because he knew he was going to die, because he was becoming so incapacitated. And where did they go? They go to Minnesota? And I think they have to go like every couple weeks or something like that. But because he kept going in and with all of his symptoms, in his medical records, he is labeled as a hypochondriac.
Psychosomatic disorder, that's what some of these people are. They've got depression, psychosomatic, yeah.
And he's doing, phenomenal compared to where he was a year ago. But it's like, he's trying to go get help, and as a medical society, you label somebody as a hypochondriac. Well, this disease was literally killing him slowly, and
Yeah, the documentary I saw, it's about an hour and 44 minutes, and it was my coworker that turned me onto it a few years back because of her struggles with Lyme's disease and her family's, and you can see it on YouTube.
Do you know
and
what
you
it's
can see
called?
what's that?
Do you know what it's
Under
called?
Our Skin.
Under Our Skin.
Called Under Our Skin. And similar to what you said, that girl in Florida, he quoted a doc that said, you're kind of a pretty girl, apparently you're not getting enough attention. That was his response to her coming in with all these symptoms.
How long is that YouTube video?
It's an hour and 44 minutes. I do have some, I can show, I just don't know how to embed pieces of it, and on YouTube they don't have pieces of it, they only have the whole thing, because there's some good footage of some of these people, especially her.
Do you know about where it is in there? Because you could just,
Yeah,
you could
I
just
could bring
scoot
it up
forward and bring that up. Would anybody like to see that?
My question is Lyme's the first tick-borne disease that we've dealt with? Actually, according to CDC and Wikipedia, Rocky Mountain spotted fever.
Mhm.
Oh, that's on
Has-
the,
has
we'll
been-
look at right.
Yeah, it was on the very
It
bottom.
was on the very bottom there.
Yep, but that's been around since the early thirties, they've known about it. As far north as Canada and into Central and South America. And it's one of the most deadly forms of a tick-borne disease. So why is it that Lyme's now is becoming so prevalent, so mass, and we're hearing all about this, and we're not hearing about the Rocky Mountain spotted fever anymore?
It seems more, like it's more common now. And the thing is some of these disorders, maybe it was a bacterial infection instead of what we think it is, like MS. You know, maybe there's more of an infectious component. It's kind of like those studies they do where they find particular viral components in inflammatory responses in coronary arteries. You know, something we never thought of 30 years ago.
Anybody got a YouTube account?
I do. I use it a lot for teaching.